On almost every street in Nigeria, there's a familiar sight. Before you see an hospital, before you see a doctor, you always meet a pharmacy, or as people popularly call it, a chemist.
I think pharmacies are closest to the people. Yeah, because if you look around your environment, if there is no pharmacy around, there must be a chemist around. So basically, pharmacies are in every corner. Yes, pharmacies are in every corner, and there are chemists as well. And sometimes people find it difficult to go to the hospital and have to go through the hospital processes before they get attended to.
For many Nigerians, that is healthcare. Not a consultation room, not a doctor's desk, but a counter with someone ready to listen.
Have you ever taken any drugs before from a pharmacy and your health condition did not get better?
Of course, several times.
So what was your next step after then?
The next step was to go for a proper test.
But why do you feel you have to visit your pharmacy first before a lab test?
We want to take medication on the go. We want an over-the-counter thing. We want a quick medication. So that's what brings about self-medication most times, or visiting the pharmacist. Because you need to report to work the next day. No Nigerian is telling you that they are about to back off from their 8 to 5 job, what put food on their table, on the account of ill health. Other places where people lazy, they might take that. So if I need to report to work, I'm looking forward to being at work the next day. I want to take a medication that can allow me to get back to work. No way I would stay, wait for a doctor for 1 hour, then they put you on bed and admit you and all those things. So that's what brings about it.
You might ask, why the chemist first?
Because it's accessible. It's not a long distance walk or drive from my home, and I get attended to fast with ease.
As a typical Nigerian, do you feel like the pharmacy should be the first place you should go to?
Definitely. Hospitals are quite busy, and it's for some not so close, and the ones that are close by, once you find yourself in the hospital, you have to queue up, wait to be attended to and all that. But with the pharmacy, you just get first-hand treatment and you go back home. It saves time.
Hospitals feel far away from many Nigerians. It's easier to go to heaven than seeing a doctor for most Nigerians. These pharmacists, they didn't ask to become doctors. They didn't ask to diagnose diseases. They didn't ask to manage complications. Yet, everyday Nigerians, the community they find themselves in, the healthcare system they live in, force them into that role.
Well, I think to an extent, Nigerians see pharmacies as hospital. Because if you check, technically, a hospital is a place where they render medical services to different kinds of conditions. So let's say someone has headache and he can go to a pharmacy and get paracetamol for his headache. And that would have been the same paracetamol he would have gotten if he had gone to the hospital. So why go through the stress of leaving his or her comfort zone, going to the hospital, and when they could actually come closer to the pharmacy, come to the closest place, which is the pharmacy. So pharmacies are closer to people, and sometimes they consider the kind of documentations they have to go through when they go to hospitals before they get attended to. So I think that's one of the reasons why Nigerians see pharmacies as hospital, because clearly they go to hospital, they get the same level of care. And pharmacists of these days, they no longer depend on, hello, good afternoon, do you have paracetamol? They give paracetamol. No, they try as much as getting to know why you want to take the paracetamol, and even suggest other things to you from your subjective symptoms. They can even give you better prescriptions from the paracetamol you came in for. So clearly, pharmacies these days, they no longer give out as you come in. No, they try to understand why you want to take that particular medication and what you're taking it for. So if they have a better prescription for it, or a better way to take care of that challenge for you, then they preach that idea to you, and if it sits well with you, then you go for it.
At the end of the day, when people get sick, they will go to where they feel seen. They will go to where they feel heard. They will go to where they feel they're going to get the least barrier to access healthcare. Going to the hospital, there are kind of so many steps you have to get through. You have to wait on long queues. You have to wait long hours to see the doctor.
So does the hospital time or waiting time affect your decisions?
Yes, a lot. With our government hospitals, it's worse because there's always a queue, then waiting to see the doctor. You spend a lot of time on that. And when you go to the private sector, the time spent for documentation and paying for cards and all that is another takes. If you are really sick, hospitals don't come to your aid at that point. There's time spent, and that's a whole lot for me.
So is it easier to explain your health issues to your pharmacy than your doctor?
I wouldn't say it's easier to explain to a pharmacist than to my doctor. I'll put it like I get to meet my pharmacist first, and he's approachable or she's approachable, and I'm attended to at that same moment. But with the doctors, that I will have to wait from the admin. Might have to meet the nurses first before getting to the doctor. And most times when it's a government hospital, you realize that there's a queue. The next patient is waiting to see. So he's always in a hurry to hear what my issues is so that he can move on to the next person. Or what my issues are before he can move on to the next person.
Primary healthcare centers, they exist, mostly on papers. And when you go there, some of them are understaffed, ill-equipped.
Have you ever been to a primary care health center before?
Yes, I have.
Have you ever used it?
There's one very close to my house. So, with my first pregnancy, I just felt that some days I won't want to go down to town for my antenatals. I could just try the primary health sector. It was not really a smooth experience because they are understaffed. The place is unkept, dirty. The nurses are irate, very angry. That for the fact that maybe they are not well paid or something. So when you get there, the whole environment does not look like a love environment or where you get the best of. I think for the few times I went there, I never got to see a doctor, a single doctor. There's just nurses and midwives there, and there's always this rush and drama going on there. I felt it was not a place at all for someone who can really afford good health care. Should not be going there for any reason.
Before I go to my next question, do you understand what our primary healthcare stands for as a Nigerian?
Healthcare that is accessible to both the average and the rich Nigerians. Healthcare that's close by, that's supposed to be your first point of contact with your medical team, so that except the cases are severe, they will not have to direct you to a hospital with better facility. I think that's what our healthcare is meant for. Our primary healthcare is meant for.
Why do you think Nigerians don't use the primary care health centers?
I don't know if you've been to a Nigerian primary health care center. It is terrible. The aesthetic, the environment. They don't even have drugs most of the time. Basic drugs are not even present. They'll have to tell you to go get, and there's usually not a pharmacy around that environment. Or for the ones that have pharmacy, they'll tell you, oh, the drugs available is just paracetamol and vitamin C. You have to buy others from down to malaria drugs, because for antenatal, the first trimester, it's supposed to give us the malaria, anti-malaria drugs, preventive malaria drugs also. And they will just, okay, we don't have this one in store. You have to go to a pharmacy to buy this in town or something. And I just feel, okay, as Nigerian, the basic drug our hospital should be malaria drugs or preventive drugs for malaria, because this is one thing that is common around the country. You cannot see that as simple as that drug is, it's not even present in the primary health care center. And when you go there, you can even wait for like, they'll tell you antenatal is for 8, you wait till 10 before they start, and you're not, oh, the nurses that are taking this team is not available. So it's really not a good one. If you have issues that needs to be solved, our primary health care can't really come to your aid.
So are you saying the primary care health centers can't be called a hospital?
No, for now, because they lack the right infrastructure, they lack the right implementation, they are understaffed. I think they are underpaid at the same time, and it's really a bad situation for the country.
I've worked in primary healthcare centers. Yeah, some few primary healthcare centers, and I've seen the level of care they give out there. There's this, I'm lacking the term to give it. There's this salary structure that Nigerian government workers get that is not satisfying. And if they happen to be an allocation to a primary healthcare centers, the superiors, because they are not satisfied with their salary, tend to divert it into their personal money. And that was the money that was meant for resources in the hospital to give better care to people coming into that facility. So people don't like to go to primary healthcare centers because the level of care they get is not satisfying. In this pharmacy, a lot of people come in here saying that they've been to primary healthcare center to carry out treatment, and they still feel the same way. Okay, let's say resources are not provided. It's not like, as a professional at the primary health care center, I don't know what to give to you, but because resources are not available to give to you, and you won't want to go get it from outside with your money. So you don't expect me to use my own money to get those resources for you to make it feel better. That's why they feel, I've been to primary healthcare center, they've treated me and it no work. No. It's possible that they've told you what to do, but somehow you think maybe they were trying to extort money from you. You said no, they should make do with what they have, and it's possible that whatever is going on with you is beyond the medication they are giving you there. That's why they suggested you go get these things outside. But because you think they're trying to extort money from you, so you decided to go with what they have there, and that way you won't get the desired result. So that's where you have to look. That's when you have to look elsewhere. And going elsewhere, of course, you will say that I've been to primary healthcare center. They do, no be like that. I myself have worked in primary healthcare center, so when I see cases like that, I know where you're speaking from.
And just before we blame most Nigerians for self-medication, we also need to realize that it's a means of adaptation. It's not rebellion. The doctors will preach to most of our patients that don't self-medicate before coming to the hospital. But how do you help a Nigerian who is sick, can't go to the hospital, and has a pharmacy next door?
Dangers of prolonged self-medication that people don't realize. Let's take, for instance, you have headache, you take paracetamol today. When you have headache, you take paracetamol. No. If you have spoken to a professional, you get to understand that not all headache are meant to be, paracetamol is not meant to be taken for all kinds of headache. There are headache that you just need rest. You relax. You drink a lot of water. You stay hydrated, and your nerves will calm down. You feel relaxed. You don't have to take paracetamol. So you can take paracetamol to an extent where your body builds resistance to paracetamol. It no longer works for your system. So that's one of the dangers of self-medication that people don't know. If you're not a professional, they barely have this idea about resistance to medication and sensitivity to medication. So most people don't know that prolonged self-medication will lead to resistance to a particular medication, and that's where you start looking for higher when you could actually use the lesser ones, and the higher the quality, the higher the money, and tomorrow you still complain about them.
What drugs are mostly abused by Nigerians?
Paracetamol. I'll go with that one, paracetamol. And for the ladies, you hear Cipro. I feel like I get infection. My friend been get infection that time. She go pharmacy, she use Cipro. Go collect Cipro. So these are the common drugs that I think people abuse: paracetamol, Cipro, and unless people that do hard drugs, I won't start talking of tramadol and the rest.
What about drugs like ibuprofen?
You hear Ibu 40, Ibu Nova. No, let's say collectively, people like to abuse analgesics. They abuse analgesics because the way people take pain reliefs is alarming. Yes, we understand that you are tired and you need something to calm down, because if you sit back, no one will feed that family. So you have to go out there again. But you have to take care of your health as well. You have to rest at some point so you can stay in the business for long. Because if you break down that same business that you don't want to stop going to, you end up not going there entirely, when you could actually rest and go there as much as you can to make this money, to make ends meet.
If Nigerians stop self-medicating today, is the healthcare system ready to receive them tomorrow?
Pharmacies deserve some accolades. Yes, pharmacies really deserve some accolades, because with the invention of pharmacies, with pharmacies being around everywhere, I think it has reduced the workload of hospitals. Pharmacies help a lot. So it's easy for people to go into the pharmacy, but sometimes they find it difficult to go to the hospital because of the stress and the processes involved. So let's say we take pharmacy out of the equation. Imagine the crowd that will be in hospitals, because hospitals will now be the only point people go to when they have, even if it's headache, you still go to hospital. So imagine the crowd that will be involved. So I think if pharmacies should be ruled out of the equation in filling the gap of healthcare in Nigeria. The pharmacists are out of the equation, the workload and the inconvenience, and it's just too much. It's too much. So I think pharmacies play a vital role in the healthcare sector, and they should be highly considered and recommended.
People don't need more lectures. They know the function of a doctor. They know what a doctor does. They know what nurses are there to do. They know what the healthcare is. They know what an hospital is. But they just need it to be accessible. They need it to be consistent. They need it to be reliable. They don't need to be told, stop self-medicating. Go to the hospital when you feel an headache. They just need to know that this healthcare is accessible to them. Honestly, we need to ask ourselves the question,
you think Nigeria self-medicate themselves because they are careless, or because the Nigeria government and the healthcare system are very hard?
Yeah, Nigerians don't self-medicate because they are careless. Most of the times, most Nigerians are, should I say, on the run daily, trying to survive, provide for family and all that. And the whole idea of going to a Nigerian hospital, time becomes something that a typical Nigerian values at one point or the other. And the idea of going to Nigerian hospital to queue or to pay for card and wait for a long time to see a doctor or to be attended to, they self-medicate because they just feel, okay, these symptoms are similar to what I've experienced before. So if I buy these drugs, it should solve my problem, and I won't have to sacrifice a lot of time and money to go to the hospital.
So if the hospitals were affordable, close and friendly, will you go to the hospital first before the pharmacy, or will you use the pharmacy first before the hospital?
No, definitely go to the hospital. I believe as Nigerians, we actually know what the pharmacy is for. We do know what the job of a pharmacist is and what the building or the structure stands for. But for the fact that our hospitals are not accessible with ease is what takes us to the pharmacy and believe that, okay, these pharmacists might be able to tell me what drugs works best. But I know it's somewhere in my mind that he's not my doctor, but he can prescribe something that would work. So if the hospitals are accessible, affordable, and friendly, definitely, I will just see the pharmacy as a point to just get drugs that are not available or readily available at the hospital.
So, to my first question, in one sentence, why do you go to the pharmacy first?
Okay. The pharmacy is accessible. It saves me time. I'm listened to. I think most of the pharmacists in Nigeria operate like a business. So as a businessman, he always creates time to hear what your issues is. They are friendly. They're friendly enough to know that they want this person to come back if there's another instance or case that the person needs to buy another prescribed drugs. So yes, I'll go to the pharmacy because I'm listened to. I'll go to the pharmacy because it's accessible. I'll go to the pharmacy because it saves me time, and most of the times I'm just going to get the drugs, so it's affordable. I don't need to pay for certain things or certain on admin for pills and filling of forms and all that. All that has been cut off already.
The primary healthcare center that should be a first point of contact for most Nigerians are most of the times ill-equipped, understaffed, or the conditions in which you make those primary healthcare, you wouldn't even allow yourself to be treated in such a condition.
So, if the primary care health centers were better equipped by the Nigerian government, will you make use of them?
Definitely. They are very close by for me, and I think in most vicinities, you could see that primary health center is usually present, and it's accessible. So, it's something you could just walk in and walk out, and you don't have to spend the whole day at. So, if they are well equipped and have all the needed infrastructure, we love and we always want to go to the primary health care center, even before even trying the pharmacy or getting drugs from the pharmacy. I'll just see the pharmacy as the point where I just buy my drugs, but I'll get my prescriptions and care and everything from the primary health care.
If the primary care health centers are well equipped, are you going to use them?
What do you wish your doctors or doctors in Nigeria and hospitals should understand about Nigerians when they visit the hospitals, when they visit the primary care health centers, and the rest of the channels that the government have created?
Okay. I would love for doctors to know that before this patient or before the individual walked into the hospital, the person have tried every possible means to solve this health issue before coming. So the whole idea of you rushing your patient or rushing me as a patient, how often has it been? Have you okay, take these drugs without hearing what I have to say? It's really killing, because I have tried. There's every percentage that the drug you're going to write for me to go and get, my pharmacist must have given that to me at some point. I have tried certain theories. What I want you to do is to hear me out. Hear me out and see if there's any underlying illness that I have not, I do not have an idea about, and you'll be able to solve. I would love for our doctors to pay more attention to us as patients. I would love for our doctors to give us time to express how we feel on the inside. Be it whether it sounds lame to their understanding or not, I would love for Nigerian doctors to pay attention to hear what the patient complaint looks like.
Conversations like this really matter, because systems don't just change until stories like this make the status quo uncomfortable. This is what you wish your doctor told you.